Well, let's turn our attention now to that healthcare report produced by KPMG. I'm happy to be joined this morning by two of those who led that report. Dr. Anna van Poucke, good morning to you.
Good morning.
You are the Global Head of Healthcare with KPMG International. And next to her is Dr. Edward Fitzgerald, the Head of Healthcare and Life Sciences for KPMG Islands Group. What's the difference in the way Islands Group and International?
Well, international covers the whole globe, so that's from Japan to New Zealand, and that's from, Canada to Chile, whereas the Islands Group...
It's a really interesting area because we cover, as the name suggests, all of the islands across the Caribbean, the Atlantic, the Crown dependencies around the UK and the Mediterranean. So we've got a real specific focus on working with offices in our island communities.
And so governments around the world are very concerned about the ballooning cost of healthcare and also finding new and different techniques to be able to respond to the concerns of its citizens. Let's start with you, Dr. Van Poucke. Talk to me a little bit about what the report finds.
Yeah, we call it in short the wow and how of healthcare transformation. And you're very right. Governments across the globe are all very worried about ballooning healthcare costs, the shortage of workforce, long waiting list. Can we keep healthcare accessible? Can we keep it equitable? Is it accessible for everybody? Can we keep the quality high? And the answer in a lot of cases is that that's going to be very difficult. What we did, we took the learnings from all across the globe. Like I just mentioned, a few countries. What are they doing to address these changes? How are they using technology? How are they supporting their workforce? For example, what role can electronic medical records play? How can we use data to have a much better view of who's vulnerable, who's not, how to act early? And then we dive deep into transformation. Transformation in healthcare is very hard because there's many people concerned, doctors, nurses, government, payers, insurers, the citizens. Everybody wants to know and say something about it. So we also looked at how are other countries, how did they do big transformations, and how are they cracking it to get the way forward?
And so, Edward, when you looked at the Caribbean region, I just want to zone in for just a moment, because while we have a shortage of healthcare, that's because it's exported elsewhere. So ours is somewhat a little different from what other territories would experience. What did you find peculiar to the Caribbean, or is there anything peculiar to how our healthcare systems work?
So I think one of the major challenges is scale, and the challenges of smaller health systems, whether there's an ability to offer the same specialisms that you might have elsewhere, whether some islands have chosen to take particular areas and spend more time working and focusing on those, and whether there's the collaboration between the islands to help support that. And the other key point is really thinking about that workforce pool, whether there's the same ability to train and then recruit and retain people, because the world of international healthcare now is becoming very, very mobile. Healthcare workers are able to travel where they're able to get the best training as well as the best return and investment on the time that they're spending to educate themselves in healthcare. And the Caribbean in particular, I think, has a number of opportunities in all of those areas. There is growing strength of regional training and education so that healthcare workers hopefully stay more within the region. But I think there's an opportunity as well for more collaboration between the islands so that the Caribbean healthcare dollar stays within the Caribbean rather than, as is often the case these days, travels out overseas for overseas care in the same way that many healthcare workers are doing themselves for jobs.
Dr. Van Poucke, you also talked about the use of digitization and technology.
Yes.
And we know in some other spaces of the world, they're introducing robotics into the practice of medicine. How much of your report speaks to that and Barbados, the region's ability to be able to adapt that as a part of its healthcare?
Yeah, we speak a lot about digitization, we speak a lot about the use of data, we speak less about robotics, we speak more about AI. Can you just imagine, we are now working with a company, they have clinical chatbots, and in case of a heat wave, the chatbots were able to phone 300,000 people to assess how they were doing, whether they were at risk, give them advice, and in case they were in danger, they ordered a taxi, brought them to a cooling center. So that's the power of data and digital. Now, what we're saying a lot is that data is going to be the new oil in healthcare. Just imagine if you here in Barbados would have an overview, a disease surveillance of NCDs. know who had NCDs, monitor them very closely by using remote techniques, and being able so have someone who has hypertension not waiting until they have a stroke, but have the data on them and being able to act much earlier, give them the right medication, keep them under control. So data and digital is going to be very important. It's going to be important to take away a lot of the strain of healthcare workers by taking away administrative tasks, but it's also going to be able to do much more continuous monitoring to know much earlier who's endangered and what we can do about it and act earlier.
Dr. Fitzgerald, is always a fear when one introduces concepts like AI. You think first of the job loss and how we integrate this into it. How do we make it work together, humans and technology and also AI and that intelligence? What's the approach beyond the horizon that we see to be able to achieve some of these?
So it's such a topical area, and I think the context in healthcare is particularly important because there is a global crisis in the healthcare workforce. We're short of healthcare workers everywhere, and countries are unfortunately stealing from other countries. So the opportunity for AI is to enhance the workforce that we have, to help support them and build their skills, to counter some of that crisis, some of that shortage. So I don't think people should be seeing it as a threat. I think it is an opportunity to be able to extend people's reach and allow them to do more with the fewer healthcare workers that we have these days. And so thinking about it in that frame, I think is going to be really important. How can we really build on the workforce that we have to help them reach further and do more? That's the approach that we're really thinking about for this.
Dr. Van Poucke, healthcare is administered at the government level. Getting this report into that level, how has it been for you so that you sit with those decision makers to make it happen?
Yeah, so the good news is we brought the report out end of October, and we have already shared it with over 2,000 leaders, both in the provider space but also in the government space. So the conscience, the knowledge that healthcare is under strain is very high in governments. Governments feel responsible because health is wealth. Having a strong healthcare system, being able to treat your citizens in the right way, to take care of them in the right way, is also giving you a very productive nation, is giving you a healthy nation. Every government in this globe realizes that their healthcare systems are under severe strain. They're all looking for the solutions. Now, healthcare is very often, I always call it, you play in the national league because it takes place within borders. That means that the ability to learn from what other countries are doing is quite small. And that's where we can come in as KPMG, having a global reach. We have healthcare practices in 70 countries. We've got 5,000 people dedicated to healthcare across the globe, and governments reach out very proactively to us and ask us, what are other countries doing? What can we learn from others? And my experience is that they are so motivated to learn, to hear about the solutions, and to really start deploying the solutions.
Dr. Fitzgerald is working to scale because not all economies are the same. Not all economies can carry the cost of the transformation that we're talking about here. How do regional governments manage this transformation, do you think, working with limited GDP?
So I think that's a really important point because any change that happens has to be sustainable going forward. And I think it also really has to come from the health system itself. And so the support that we often help provide in this situation is really the project management of being able to help support that change and really upskill the local teams so that they can help drive that forward and take it forward themselves. But I think without that, it isn't sustainable. It has to be something that comes from the system rather than a health system having something done to it. And there has to be that desire for them to change as well. I think when you have got that buy-in from the local health system, then I think there's a willingness for people to learn and develop on what is often a long journey of change. Without that, it doesn't stick. It isn't sustainable. But with that, the system is able to change itself, even within the constraints of the GDP restrictions it might have.
And so, Dr. Van Poucke, you know, the report seems to me to tackle a number of layers of healthcare, from the low-end healthcare provider right through to the administrator. And so access to this information? How accessible is it to everyone who works within the healthcare system to be able to mine the information therein?
You just fill in Healthcare Horizons Revisited, KPMG, and you are being brought to the right website and you can download the report. So that's the easy answer. What we do, and that's why I travel all the time, I work with the local practices. So here in Barbados with the KPMG Islands practice, but in a couple of weeks I will be in Japan and then I will be in the US. So I am working continuously with the local teams to bring the knowledge and the contents of the report. And when I'm traveling, we organize a lot of sessions. So yesterday we had a beautiful session. We had about 60 people in the room. The whole healthcare ecosystem of Barbados is there. And we tell them about the report, but more important, we then have very intensive dialogues with these stakeholders to really go in depth to the content and help them what is applicable to different nations. Different nations will have different needs, but that's where we come in to help the stakeholders to get the knowledge, the access. But visiting the website is a very easy one of getting access as well.
Remind us the website.
You just type in Healthcare Horizons Revisited, KPMG, and then you will be led to the website immediately.
Healthcare Horizons Revisited, KPMG. Just Google search that and you're good to go. You'll be taken right to where you need to go. For acceptance, there has to be engagement at all levels. And so how do we begin? When next? What's next basically? The report is presented. You've had the engagement. What's next so that the people who you're serving also don't have a fear and a resistance to what you're actually trying to do?
Yeah, I think it's great to share that this afternoon we will have a meeting with Future Barbados and we will have the conversation exactly there. They were at our meeting yesterday. They have access to the report and what we're going to discuss, what are the examples worldwide that are really relevant for Barbados? What can they use? What can they harvest on? And then what we're going to have the conversation about, how can we run the program together? And that's essential in healthcare, to run the program in the right way. I had a client who said very rightly, don't do to your clients, don't do to the community, do with the community. So one of the approaches that we have as KPMG is that we work very intensively with everybody involved. So when we do that transformation program, we will work with administrators, but we will work with doctors, we will work with GPs, we will work with nurses, medical specialists, we will work with funders, with governments, bringing them all together in the room and helping them to make the right decisions and helping to bring new ideas and new concepts that they can start using here. But having everybody, don't try to do it by yourself. You need to have everybody in the room. It's a tough job, but it's a very rewarding job.
I just love those 4 letters, WITH, W-I-T-H. That's so critical to the delivery of healthcare and any form of transformation at all, you know, where everyone sits at the table, everyone shares, and so it works that way. But within the islands of the Caribbean, though, Dr. Fitzgerald, you know, we're separated by water. On a continent, it's a lot easier. We just travel, you fly wherever the case, but you drive. But because of that separation, there's a sense of autonomy. It's mine. I don't have to share it with you because we're separated by water. How do we within the Caribbean begin at that level to sit down among ourselves to begin this transformation?
So I think some of that conversation already happens. If you speak to healthcare professionals and providers, there are very good links across the Caribbean region. Whether that's as strong at the government level, whether there's opportunities there for greater collaboration, I think there are. And I think that can take a number of forms. That could be around healthcare workers sharing their skills between different islands. It can be about sharing training. It can also, of course, be about sharing patients and perhaps having some centres or areas that specialise in one thing and another. That coordination and collaboration, I think, is really important to strengthen healthcare in the region, because actually when the islands are added together, that scale is there. And I think there is a willingness to look at that more now.
You know, the horizon is what we can see, is all we can see, but KPMG's report takes us beyond that horizon now. There's a new way of thinking when it comes to the delivery of healthcare, and so we're excited about the work you've done, both of you doctors, and so we can't wait to hear the next steps. I know you have another session today. What time is it and where is it?
We're going to be meeting this afternoon, actually. We've got a number of meetings where we're going to be sharing some more outcomes from the report.
Brilliant. We can't wait to hear more. Remember, good folks, go to Google, check the new Healthcare Horizons Revisited Report, KPMG. It's right there on your screen. That's what you'll see. And once you see that, you know you're there. And because you're there, take some time to browse, to read carefully, not just as a healthcare provider, but as a patient, because you also want to see what's new and cutting edge on the horizons of delivery of healthcare indeed. Dr. Anna Van Poucke, good morning, and thank you so very much again. Dr. Edward Fitzgerald, thank you too. They're from KPMG, and the report is now accessible to all of us. It's important that we all get to know what's in that report. All the very best. Thank you.
Thank you very much.
You're very welcome. Morning Barbados continues in just a moment.